All right, Dr. Jodi Nicholson, welcome to Green Pill. First question, will you take the green pill?
Absolutely. I think I will go ahead and take the green pill.
All right, that's the spirit. Like the red pill, the green pill is where we believe that there's a world that everyone can prioritize their health, both mental, emotional, spiritual, physical, and in that world, people feel pretty good, pretty in control of their environment. Their health span is long, and they feel that their wellness, their well being is something that they have agency over. So, Dr. Nicholson has an LPC-S degree. She's been doing this for more than 10 years. Her practice is located just outside of Dallas Fort Worth area. And what I liked about her site was it said wellness starts with you. And in the course of our discussions, I learned that she's been in a number of different care environments before going into private practice and as she came into private practice. So maybe, Dr. Nicholson, you could start by just telling us what got you into the mental health field in the first
Yeah,
place.
absolutely. In the past, when I was asked this question, would always give a really canned answer that I got in this field to help people, which that's
Hmm.
true too. But really, I got into the mental health field, I think, really to figure my own self out. I later have come to realize that I deal with anxiety and have for some time, but didn't really have a name for it or even recognize it as anxiety. In communities of color, mental health is not something that is generally discussed or acknowledged or even really treated. So I grew up, I think, really not having the language or being able to even identify what it was I was experiencing until I started the journey of becoming a counselor myself. So I think that's really on a deeper level what got me into this field.
And thank you for giving me an answer that felt very personal. 10 years back, did you know at the time when you were changing and moving towards this career that it was something ultimately internal in you and like in your personal history related to anxiety and related to some feeling that you couldn't really recognize? Was that apparent at the time 10 years ago, or has it become more apparent over time? And yeah, how was
Yeah.
that?
So really it became more apparent in my coursework as we are learning about
Okay.
symptoms and looking at case studies and really seeing the different ways that anxiety can present itself. I started to look more internally at my own stuff, my own symptoms. There were also some assignments I remember having in graduate school where we did have to do some really personal, in depth internal work of our own in the process of becoming therapists that really forced me to look a lot deeper and look back at to some of the early childhood experiences that I experienced and really see where some of my anxiety was even rooted in that at the time again I didn't realize that's what I was dealing with. So I would say that my self-discovery definitely started earlier than the 10 years ago, back in graduate school, when I was first working on my master's, in fact.
Hmm. And when you were growing up and in communities of color generally, so both your personal story and then what you've observed in other folks, how is struggle defined when there's either a traumatic experience, there's hardship, and then there's what you call anxiety now? How is it
Mhm.
talked about, if at all? I know you mentioned it's not really talked about, but like how is struggle talked about, or how is difficulty talked about, if not using the words like anxiety and
Right.
etc.
In some sense, I feel like struggle is seen as like a badge of honor. The more struggle you
Hmm.
have, that is a indication of your strength or your endurance. And so in that, mental health is not really discussed. It's uh, not really seen as something even real, in fact. So growing up in that, you didn't really have a place to be able to talk about how you were feeling, whether that be anxious, whether that be sad, whatever that emotion was, because that wasn't really acknowledged, that wasn't really given attention. We were taught to get back up and keep moving forward. And I don't think that just started with my generation. I think that's rooted in earlier generations, looking all the way even back to slavery, where we were in survival mode. And I think as a culture, we have been in survival mode for so long that we haven't had the time to take care of ourselves emotionally or mental health wise. And I think younger generations like myself, we are starting to make that more of a priority and really understand that struggle is not something that we should be carrying as a badge of honor. It's not healthy. It's not healthy physically.
Mhm.
It's not healthy emotionally. And it's not something that we want to pass on to the generations that come afterwards.
And so it sounds, given the history of Black Americans in the US and communities of color in the US more broadly than just Black Americans, it almost sounds like struggle was a badge of honor because it was incessant and constant, or at least almost always present.
Mhm.
And if you, I hear you nodding your head on audio here. And so if it was always present, and then perhaps in younger generations who have been able to transition out of full survival mode and maybe into thriving or being okay. How does one shift that mindset, both you personally and then folks you work with, maybe, or your family, or just folks like how, because it's a big
Right.
shift, right? If struggle is ever present, but then now we're
Yeah.
okay, like how does that
Yeah.
happen psychologically?
I think for me, the shifts happened because I was in school. I was learning about it. I was in a space that made it safe to be able to make that shift. And I think that I would say similarly that in therapy, providing that safe space for people of color to come and be able to talk about how they feel, to feel validated. I think that is what allows people now to be able to make that shift. A lot of times in communities of color, when we talk about how we feel, it's not validated, it's dismissed. And so I think that just creating those safe spaces allows people to be able to talk about it and be able to make the shift so that they can begin working on their mental health and being able to prioritize it. And I think too, the more that we talk about it, there's a lot of still stigma around mental health, especially in communities of color, where it's viewed as there's something wrong with you, or that you use the C word, you're crazy. And being able to reduce the stigma, making it okay for people to acknowledge that they need help is also what helps, I think, people be able to make that shift.
And so if I may summarize and make sure I heard you correctly, it's one, just spreading the word generally. Two, having a safe space to explore it, which for you was
Mhm.
school. You had a lot of theory and a lot of practice because you had the self exercises as well. And so, safe space, spreading the word generally, maybe the culture is shifting. Is there any other part of that I missed, or that we should touch on about how that dynamic change, how that concept of mental health changes over
No,
time?
I think that's the main, I think those are the main points. Being able to create those safe spaces where people can be able to share how they feel and feel heard and feel validated.
And how on on a personal level between individuals, when you take a patient, when you take someone and their dad or their mom, and in my case, is really probably mentally not fully healthy. Let's say that they're either disordered personality. I don't want to use clinical words, but they're just really not happy, let's say, and they're probably affecting the people around them, and their life maybe is unmanageable or maybe just barely manageable. And folks in that generation, it seems like their language for mental health is limited. It's either you're crazy or you're not, and just get over it,
Mhm.
right? And so, how do you counsel folks to talk to their parents, or how have you done it yourself and kind of broken through that binary one or zero, like
Mhm.
crazy or okay? Because it's not a safe space outside of the therapy office. Folks want to help their families, they want to spread the word, right? Like, how is that? How do those conversations
Yeah.
happen?
So I really enjoy being able to educate clients. That's part of the work, the therapy that I, part of my approach, therapeutic approach is psychoeducation. So educating them about different mental health conditions. I do a lot of comparison to physical health conditions because there's
Hmm.
generally less stigma around those. And also talk about how conditions can happen on a continuum. So you can have mild, moderate, severe. You can have different ranges of symptoms and conditions. And so just providing education around that, providing examples and comparisons to more familiar, less stigmatized conditions allows people to be able to share that information with family and also just understand it for themselves. So that's my approach as far as that goes.
And so educate folks, use metaphors like, hey, if you had a broken arm, you wouldn't just sit there with it, that kind of
Absolutely.
thing. And how do, I guess that you touched on a continuum, because I want to go from how do you go from, oh, you're crazy to, oh, you're not doing great, but you could be doing
Mhm.
better. Because it is a generational thing in any community, really, in any family. If the parents aren't giving space to talk about your feelings, then the children will typically not have the language for it and not have the communication skills to say I'm not okay or I am okay or I feel a certain way. When it comes to communities of color, you're getting the word out through psychoeducation in your
Mhm.
sessions, right? Folks are feeling better themselves in your sessions, right? Because they're actually talking about something maybe for the first time or first few
Mhm.
times. Do you see radical shifts in people after they start voicing what's going on?
Absolutely. That first session is it's the intake session, but it is also
Hmm.
what we call the dump session. So I'll have clients say, "Wow, I needed that. I felt so much better after that first, even that first session." And we haven't even really gotten to
Hmm.
any type of intervention yet. It's just being able to sit with someone, hold space for them, let them feel heard, validate how they're feeling, and maybe normalize some of their experiences that really is powerful even in that first session. I think that there is a lot, people do get a lot out of just being able to tell their stories. I have so many clients who've said, I've never said any of this out loud, or I've never told anyone else this before. And I always feel very honored to be able to hold space for them in that way, and that they would be so trusting to share some of their hardest life experiences with me. And so I think even that in itself can be very, very therapeutic, just to feel heard and to be able to get things that they've been holding on to for so long, some years, being able to get that out is very, very cathartic.
And what are the accelerants and what are the barriers to get folks, especially in communities of color where mental health just isn't as commonly talked about? Anyway, what I'm trying to ask is what gets people into your door in the first place? Because it sounds like once they're there, that first session is just
Mhm.
profound for them, right? Because they've never talked about something. Imagine going 30 years, 40 years, 20 years, 10
Mhm.
years. So what gets them there in the first place and what are the hurdles they got to jump over to get there?
I think for the clients that I see, one is accessibility. I
Hmm.
see a lot of clients with EAP benefits who, because their employer is paying for these services, now therapy is more accessible to them. I've had clients that said, I've always wanted to go to therapy, but I couldn't afford it. And so now that they have this benefit through their employer, which provides a certain amount of free sessions, therapy is now accessible. I think the other part is and I see clients from all different cultural backgrounds, but seeing a therapist, seeing someone that looks like you, I think people feel a little less guarded in communities of color and reaching out and seeking therapy. Whereas beforehand, they may have been a little bit more reluctant because there was less representation in the field. I think with the clients that I see, those two are pretty big factors in terms of what may incite them to seek counseling.
Hmm. Makes sense. So the access is one, and EAP is employee
Yeah.
assistance program. So it's not so much your health insurance for folks listening, but it's the supplemental wellness or financial
Mhm.
assistance, counseling. There's all kinds of pieces of employee assistance programs, including mental health.
That's
Is that
right.
right?
Yeah. It's a very underutilized benefit. A lot of employers have
Hmm.
it, and I encourage all clients people in general to access their EAP benefits. And they're also usually available to anyone living in the household, regardless of age or if that individual
Really?
is on their insurance plan. So,
Yeah, if they're married or if they're not on the plan. That's really interesting. I
hmm
didn't know that. So that's a big piece of access that folks we need to get the word out
yeah.
essentially. Do you see that? Do you see anything changing on the EAP front or the on the company corporate wellness front that's been driving that more? Have you seen like any of these apps come out or any of these other programs that are end up having more folks knock on your door? Have you heard of any changes on that front?
I haven't heard of any significant changes other than
The word out.
I'm seeing more employers, especially since the pandemic, I'm seeing more employers starting to adopt EAP programs. That I have
Hmm.
noticed. Outside of that, general benefits seem to be pretty similar to what they've been in years past, as far as you mentioned, counseling, financial, legal consultation, resources for childcare, caring for aging parents, things like that. Those benefits seem to be pretty consistent, but I would say it looks like more employers are starting to prioritize the mental health of their employees and their workforce. And so I'm starting to
Hmm.
see more companies offer that to their employees.
Hmm. Makes sense. So I'm glad that's spreading a little bit. I just had the head of UC Irvine in California. They have 30,000 or 60,000 employees, and she's the mental health department head. So she was first working in the counseling
Hmm
center, then she would do mental health first aid training all around the university and the medical center. And now she serves as the quarterback for employees who need to navigate their benefits. And a lot of them use EAP for
Yeah.
therapy ultimately. And that's what she does. So it's cool to see that it's getting a little bit more popular after the
Yeah.
pandemic. Switching gears a little bit here, we talked about access, we talked about getting folks in the door. We talked about the first session being really cathartic for folks. How do you keep people with you, and what do the subsequent sessions usually look like?
Yeah. So in the intake, I'm going to go back to the intake session. At the end, we set goals,
Hmm.
and those goals are collaborative based on, I may suggest some things based on what they're presenting with, as well as check in to see what is it that they want to work on. Subsequent sessions are tailored to address the goals that we've set in those first sessions. And we may prioritize the goals. What is it that you want to work on first, depending on how much they're bringing to therapy. And I think that tailoring the sessions in line with the goals and in line with what they are wanting to work on, get out of counseling, keeps people returning. As along with, I'm big on homework assignments, giving clients something to do, something to work on. The most work with therapy Most of the work in therapy is done outside of the session. And so homework really reinforces that so they can be able to apply the skills and the tools that we're learning in their life and really start to see the changes take shape in their life and outside of our office.
Yeah, and you talked a bunch, and I do want to get back to communities of color topic because I think it's really needed to talk about it, just and interesting. But going back to homework, what kind of homework do you give folks? Is it physical homework? Is it mental homework? Is it mindfulness
Mhm.
homework? What are the kinds of homeworks you give to folks, even though they're not in school anymore, usually?
Yeah, it's usually a combination of some of those things. So it may look like, okay, we're going to start exercising or doing some sort of physical activity at least twice a week, and then we'll build up to that. We talk about how physical activity is good for our mental health as well. It's a helpful tool for really either anxiety or depression, any condition. It's just good overall. So, physical activity, homework assignments to help them identify and process their feelings. So, that might look like journaling or doing a thought record, or may incorporate like a mindfulness, or not a mindfulness, a mood tracking app. And then I
Okay.
also may introduce a skill in session like breath work or a guided imagery type of activity that I'll, for homework, have them to practice between sessions. So, those are some examples of some of the homework assignments that I might have clients participate in.
And do you mind if I ask you, and with anxiety and depression and exercise, I always feel better when I exercise, and when I'm feeling anxious, I never walk out of the gym or after a run feeling worse, and I'm sure you feel
Hmm.
the same. Do folks ever ask you and say, like, why is it important? Like, how does exercise affect anxiety, or how does exercise affect my depression? Do you ever get that question?
I haven't had anyone ask that, surprisingly.
Review
Yeah,
it.
they're just okay.
They're like, no, they're like, all
I
right,
think
yeah,
they've
of
heard it
course.
somewhere before, so it's not an unfamiliar concept to them. I think for them,
Hmm.
it's when people think of exercise, I think their mind automatically goes to some high intensity type of workout. And
Hmm.
so that to them can feel very overwhelming or very daunting. And I just let them know exercise doesn't have to be this rigorous, high intensity type of workout where you can't walk the next day. It could be going on a walk for 30 minutes or doing yoga, doing something light, something to get your body moving and active. It doesn't have to be this strenuous thing where you're feeling like you can barely move afterwards. And so really giving them some other examples, I think helps them, warms them up to the idea of, okay, yes, I can see myself doing that or doing something fun. Pickleball is such a big thing now. So being engaged in something that they enjoy, that's fun and also gets them moving. Those are some other examples that I try to provide to give them ideas on how they can incorporate exercise into their lifestyle.
Nice. So fun or just movement or just
Hmm.
walking. Totally agree. And from the doctors I've listened to recently, there have been some longitudinal studies where they'll measure folks' step count. It's like done in 2006 or so. It was published in JAMA, which is one of the bigger medical journals, and they had about 7,000 to 10,000 steps was recommended, and the all-cause mortality of folks, so people dying in the next 5 or 10 years who had 7,000 and 10,000 steps from anything, from cancer, heart disease, etc., was much lower than folks who had less than 7,000. If you went above 10,000, that was
Hmm.
okay. So it's funny how the step count, which I think was originally came up with by a Japanese company who produced a pedometer and didn't have any actual meaning. Everyone says, oh, 10,000 a day, but actually 7 to 10,000 is
Yeah.
quite good. And then you mentioned pickleball, which is great. Any sport. I always orient towards, I ask people what they've done in the past. What'd you do when you were a kid? What'd you play as a teenager? Did you dance? Did you wrestle? Did you play basketball? Can we get that back into your life a
Hmm.
bit? How do you hold folks accountable to not just exercise, but I love the mood journaling app, record your mood. That's a really tech savvy way to do it. And do they come in and show you the app, or how do you make sure they do their homework without you orienting to a coaching role, without you orienting towards like a boss role, because you don't want to be like
Right.
nagging them? How do you keep track of all that stuff?
Yeah. So I will ask them to bring in their homework assignment with them outside of the app. Most of it is something tangible that they can bring in with them, and I'll just check in to see, we process what they did, what that experience was like for them, how they felt after they did it. There's some process work that happens after we check in with the homework assignment. So I don't I do try to show grace, but I also hold them accountable to the goals that they set and just remind them of the goal and how the homework assignment is part of that, and part of them getting to where they want to be ultimately.
Do you ever go like into the realm of, hey, using questions such as, are you sure? Do you not want to lose the weight, or do you not want to feel sexy in your
Mhm.
body, or are you no longer committed to fitting? I don't want to say fitting into that dress for the wedding because I don't like to orient that way. Are you no longer committed to getting a daily movement
Mhm.
practice in? The one thing I've struggled with is, like, keeping people accountable, but I'm always asking yes questions. I'm always like, did you do this? Did you do this? Did you do this? But sometimes asking them the opposite, because you said you're graceful, but you can be a little bit strict, it sounds like,
Yeah,
in some ways. How do you like communicate that to people without offending them? Something I'm really working
yeah.
on.
I use a little bit, I think, of motivational interviewing. So I'm big on the stages of change. And so I will check in with them on whether they've done the homework assignment and how important to them this goal is that they're trying to reach. What are they willing to do to reach said goal? What is it? What are they, yeah, what are they willing to do to reach the goal? So I try to approach it that way, and I may have some gentle confrontation if I have had clients say, "Oh no, I didn't do the homework assignment," or "I forgot." So really trying to explore what that's about. Is there some resistance happening there? Is there fear? What's underneath that? And whether it is, like you said, is it something that they still want to work on? Because if it's not, that's okay. This goal, the treatment is about what they're needing to get, what they're wanting to work on, and I can't want it for them. They've got to want it for themselves. Just having those honest conversations with them about what it is they want to do and what they're willing to do to work on that goal, I think that's important. I have had clients who've said, "Yeah, I do I do want to stop smoking, for instance, but I'm not ready to quit just yet." And I appreciate that honesty because that allows me to see where we need to go going forward and how we guide our sessions, what we need to focus on.
I like the smoking example too, because they know they want to stop, but not right now. It is a big thing to
Yeah.
stop smoking. It's really rough, I can
Yeah.
imagine. And same way, weight loss is pretty hard. Like caloric restrictions, not super
Mhm.
fun. Changing your habits, not easy,
Yeah.
right? Changing what you eat, when you eat, how you eat it, where you order it from, how you prepare it. It takes work. And if you have a couple of kids, your job is stressful, whatever, it's a commitment. So I definitely hear that. And I think you build this trustful relationship over time with first the intake and not typical psychotherapy, but different tools that you use to understand where people are coming from. And then when it comes to behavioral change, maybe a few sessions in, or maybe even much further down the line, they already trust you and can be
Mhm.
honest. One thing I run into, just as a small aside, is that folks come to me to make change, right? It's not so much a psychological journey, although of course it is. But then they come to me to make change. And when there's resistance, or they start forgetting, or they start doing half, but not all, I use motivational interviewing, but I'm also like, hey, why are we here? And so I think it's a little bit different dynamic when it comes to
Mhm.
coaching. Of course, there's always tons of things to work on. Okay, so you just don't want to start going to the gym. Okay, let's
Mhm.
start walking. Okay, let's start walking your dog twice a day instead of once. Let's get your non exercise thermogenesis up. So let's move around the house more. So there's a lot of different ways to approach. I think I was just curious how you gently confronted people, and I think it's that foundation of honesty where people actually can tell you, I changed my mind
Mhm.
on this, or I'm not
Yeah.
ready.
And I like that example that you used about, okay, you're not ready to go to the gym, maybe let's start walking. I like meeting people where they are. I think that's really important in therapy, and I think people feel more trusting if you meet them where they are versus trying to push them too far ahead. Yeah.
Hmm. Yeah, for me, it's something I just personally, I see someone and they tell me where they want to be. And I say, wow, you can absolutely get there. Here's the 17 things you need to do. And when they do nine of them, but not 17, I'm like, listen, if you just did 17, if you did eight more things, you would
Uh-huh.
get there. And that's not exactly meeting them where they are. It is humans are, I don't want to say complex, but there's a lot going on in life.
Mhm.
So I think having some grace that you have is nice. I'll try to borrow
Yeah.
from that. Thank you, Jody. As we're concluding here, and I wonder, is there any message you want to get out to the world that, folks, potential patients listening to this, or folks that, from all your experience and from everything we discussed today, anything you'd like to get out there so folks can hear?
I would just like to continue to encourage people to prioritize their mental health and wellness. You don't have to be in crisis to come to therapy. Don't put it off. I think that it should be just as important as anything else you do health related, whether that's going every 6 months to the dentist or going annually for a physical. We need to prioritize our mental health and wellness in the same vein. So, just really encouraging people to make that the priority is a message that I would like to leave them with.
Thank you. Likewise. And I think that physical metaphor makes a lot of sense, and folks wouldn't walk around with a broken tooth or a fractured arm. And likewise, if folks are out there struggling, don't wait. Call someone and get started and try it, and you will feel better, especially even just in the first session, which not many other things can
Yeah,
guarantee. Dr. Nicholson, thank you so much for coming on. I know folks can find you on your website. It's pathways to healing.net, and we'll link that in the notes on YouTube. Is there any other place folks should know, or that's
that's
the
the
good
good
one?
one to find me.
Okay,
Yeah.
perfect. Perfect. Thank you so much for coming on Green Pill. I
Thank you
really
so much for
appreciate it.
having me.